Subcommittee will come to order. Chair will recognize himself for an opening statement. Today, the subcommittee will consider two bipartisan bills. First, H.R. 3299, sponsored by Representative Brooks, and SU, Strengthening Public Health Emergency Response Act, builds upon our previous work to modernize our biodefense systems to ensure that we are well equipped to handle current and emerging biothreats, and was the subject of a health subcommittee hearing on May 19, 2016. Second, H.R. 921, sponsored by the Vice Chair of the Health Subcommittee, Representative Guthrie, with 159 co-sponsors. Sports Medicine's Licensure Clarity Act provides clarification for purposes of medical professional liability insurance as carried by sports medicine professionals who provide certain medical services in a secondary state. This bill was the subject of a hearing before the subcommittee last December 9, 2015. In 2004, Congress enacted the Project BioShield Act, and later in 2006 enacted the Pandemic and All Hazards Preparedness Act. In addition to establishing a strategic plan to direct research, development, and procurement of medical countermeasures, MCMs, PAPA also established the Biodefense Advanced Research and Development Authority, BARDA, within the Department of Health and Human Services. BARDA was charged with coordinating and accelerating the development of MCMs. BARDA was created from the understanding that most MCMs needed by the nation did not yet exist, and their development is a risky, expensive, and lengthy process. There's no market for vaccines and therapeutics that protect against bioterror agents outside of the U.S. government. BARDA bridges the funding gap between early-stage research and the ultimate procurement of products for the national stockpile under Project BioShield. By partnering with private industry, using money from the Advanced Research and Development Fund, BARDA can reduce the development risk entailed in MCM research, thereby helping to mitigate the disincentives associated with countermeasure development and ultimately improving our national readiness with regard to a CBRN attack. The bill before us today reforms our nation's medical countermeasure acquisition process, incentivizes research to combat the next generation of deadly diseases, and increases accountability of preparedness spending. Such improvements will go a long way towards helping our preparedness for future public health emergencies such as Ebola by creating new incentives for developing necessary medicines and vaccines and streamlining the contracting process for medical countermeasures. When Congress created the BARDA office, we modeled the contracting authority after DARPA to ensure the office had flexibility and could operate efficiently. Incentives are necessary to attract private investment in product development. Likewise, the contracting processes must be efficient. I want to thank the sponsors for their bipartisan work on this critical issue. I know that you're continuing to refine this legislation and addressing outstanding issues, but it is clear we agree on the goals of the legislation, and everyone is working in good faith to move this bill. Now, a quick word about H.R. 921, the Sports Medicine Licensure Clarity Act 2015, which was part of a health subcommittee hearing held last December, and would clarify medical liability rules for athletic trainers and medical professionals to ensure they are properly covered by their malpractice insurance while traveling with athletic teams to other states. The bill is supported by leading national professional and collegiate sports organizations such as NCAA, MLB, and NFL. Also supporting is the American Medical Society for Sports Medicine, the National Athletic Trainers Association, the American Academy of Orthopedic Surgeons, and the Physicians Insurance Association of America. I support each of these bills. I urge their adoption by the subcommittee. Yield back the balance of my time. Now I recognize Ranking Member Mr. Green. 5 minutes for his opening statement.
Thank you, Mr. Chairman. Today we consider two bills aimed at improving our health care system. H.R. 921, the Sports Medicine Licensure Clarity Act, will promote the safety of our athletes by ensuring that sports team, physicians, athletic trainers, and other providers can treat their patients regardless of whether they are home or away. Many medical liability insurance carriers do not offer coverage for care provided outside of the state in which the provider is licensed, making it difficult for the team health care professionals to maintain the adequate coverage while traveling throughout a sports season. H.R. 921 will clarify certain aspects of the medical liability and malpractice insurance to address this issue in a targeted manner. We'll also be considering an amendment to the bill to include chiropractors and physical therapists that treat athletes, which I support. H.R. 3299, the Strengthening Public Health Emergency Response Act, aims to improve biodefense capabilities within the Department of Health and Human Services. This legislation, drawn on the recent Blue Ribbon Study Panel on biodefense, and makes targeted reforms to streamline existing programs, enhance coordination between agencies, and create incentives for the market to enter these medical countermeasures market, or as MCMs. I appreciate this legislation recognizes that incentives are needed, and MCM development does not flourish without a strong commitment from the federal government. I support the intent, but believe the best way to incentivize MCM development is robust and stable funding, like what Congress did when it created the Project BioShield Special Reserve Fund, SRF, in 2004. The availability and certainty of this 10-year fund offered a positive impact on the government's ability to attract innovator companies. 12 MCMs against several national security threats were delivered to the national stockpile under this program. Unfortunately, the shift to annual appropriations and less funding in general has created uncertainty where there was once confidence and there would be a market for urgently needed medical products. The amount of cooperation between government and the private sector has improved, and our level of preparedness has increased over the last decade. But we must do more to meet the new challenges we face. The current Zika virus epidemic underscores our need for a robust pipeline of vaccines and treatments effective against current and emerging threats. Last month, researchers have found a person in the United States carrying bacteria resistant to antibiotics as a last resort. An alarming development could mean the end of the road for antibiotics. Antibiotics and other medical countermeasures are similar in that they are central to our health and national security, yet traditional market forces that drive the development of these therapies for other diseases are not sufficient to enable a robust pipeline for new treatments. There is a clear and vital role for the federal government to play in order to contribute to greater public health security and ensure preparedness against biological threats and emerging infections like drug-resistant bacteria. This requires meaningful research incentives, strong public-private partnerships, transparency and predictability, and flexibility in contracting mechanisms. We need to break the cycle of lurching from crisis to crisis, outbreak to outbreak, and invest in public health infrastructure and medical product development that protects us against current and future threats. H.R. 3299 puts forth a range of reforms to improve MCM development and procurement in response to emerging infectious diseases and hospital preparedness. I want to thank the bill sponsor for their leadership on this issue and will continue to champion programs and mechanisms to spur the development of life-saving products that protect our health and national security. We will continue to work to iron out aspects of this legislation. I believe we can strike the right balance to best protect the health and welfare of our nation. Mr. Chairman, I yield back the balance of my time.
Chair, thanks, gentlemen. Now recognize the chairman of the full committee, Mr. Upton, 5 minutes for an opening statement.
Well, thank you, Mr. Chairman. I want to recognize our former good friend who's sitting in the front row, Dr. Phil Gingrey, as well. Nice to see you, sir. So today our work continues to improve the public health as we consider two bipartisan bills, H.R. 3299, the Strengthening Public Health Emergency Response Act, and H.R. 921, the Sports Medicine Licensure Clarity Act. Emergency preparedness has long been an important focus for this committee, and while it may not be a topic at the forefront of everybody's minds, our state of preparedness certainly will impact everyone in my state of Michigan and around the country. The 2014 Ebola crisis and the current Zika outbreak are just two examples of natural biological threats that we have to take very, very seriously. Threats range from the common and naturally occurring infectious diseases such as the flu virus to biologically engineered weapons of mass destruction. Instead of responding to each emerging threat as an individual crisis, we have to develop a comprehensive strategic framework that we can use with each new threat. One of our main challenges in addressing biologic threats is leadership. The Blue Ribbon Study Panel noted in their bipartisan report that we need clear leadership for biodefense, saying, quote, centralized, effective leadership is necessary to direct and harmonize their efforts but because this is lacking, biodefense activities are insufficiently coordinated, end quote. So the Strengthening Public Health Emergency Response Act, authored by my good friend and Susan Brooks, sitting next to me almost, and Anna Eshu, is an important step forward to keeping Americans safe by ensuring medical countermeasures are developed and procured. This bill has GAO examine how grants are being used to make sure that goals are being met, requires BARDA and CDC to better coordinate, streamlines countermeasure procurement and contracting processes, and modifies the Tropical Disease Priority Review Voucher Program. We're also going to consider the Sports Medicine Licensure Clarity Act introduced by Subcommittee Vice Chair Guthrie and Richmond to help ensure that sports medicine professionals are adequately covered by their liability insurance while traveling with their athletic teams in other states. Current law is ambiguous as to how their insurance covers their work out of state, and this bipartisan bill acts as a solution to this often routine problem, particularly in a state like mine, whose district adjourns not only the state of Indiana, but also Illinois. We've got two important bipartisan bills that will help improve the public health, and they deserve our continued support, and I yield back. Thank you, Mr. Chairman.
Chair, thanks, gentlemen. Now recognize the ranking member of the full committee, Mr. Plone, 5 minutes for opening statement.
Thank you, Mr. Chairman. Today, the committee is considering two bipartisan bills. The first, H.R. 3299, the Strengthening Public Health Emergency Response Act, strives to help increase our emergency preparedness in two key ways. First, it would improve our medical countermeasure capabilities within the Biomedical Advanced Research and Development Authority, or BARDA, at HHS. And second, it would provide additional incentives to companies that choose to manufacture medical countermeasures. The second bill, H.R. 921, the Sports Medicine Licensure Clarity Act of 2016, would ensure that sports medicine professionals who travel with sports teams have access to their liability insurance. And I want to thank the chairman and the staff for their willingness to work with us to address some of the concerns that have been raised regarding both of these bills. I also want to thank my colleagues and sponsors of H.R. 3299, Ms. Brooks, Ms. Eshu, for their commitment to improving our ability to respond to biological threats. And this bill includes a lot of important provisions that will make a real difference. But I want to highlight two remaining concerns I have with it. While I support making improvements to BARDA's contracting process, I worry about the consequences of injecting undue influence into the contracting process if the contracting office is moved to report directly to the BARDA director. I understand this provision is intended to speed up the contracting process, but as we've heard at our hearing, BARDA's acting director opposes this change because it attempts to fix a problem that doesn't exist and could have the reverse effect of actually slowing down the process. In fact, he explained that BARDA's average contracting timelines already take less time to complete than allowed by HHS guidelines, and that the current process has a track record of success in meeting emergencies. For example, the completion of a recent contract to supply blood to Puerto Rico in response to the Zika epidemic was completed in 6 business days. I'm also worried about the consequences of further expanding the Tropical Disease Priority Review Voucher PRV program under this bill. The PRV program was intended to incentivize research and development of drugs to prevent and treat tropical diseases that disproportionately affect poor and marginalized people. And to date, the program has not worked out as intended. There are serious unresolved issues that must be addressed before the program is expanded. For example, under the current program, sponsors were rewarded even though they did not invest in new drug research and development or did not facilitate drug access to those suffering in poor and underdeveloped countries. This conflicts with the goals Congress had when it created the program in 2007. I still believe we should explore other ways to incentivize medical countermeasure development, but expanding the tropical disease PRV program is not the answer. I remain concerned about the impact program expansion will have both on the value of the PRV as an incentive for drug development and on FDA resources. An influx of PRVs will reduce market value and therefore reduce incentives to invest in research and development of drugs to prevent or treat rare pediatric diseases, tropical diseases, and medical countermeasures. Additionally, an influx of PRVs will undermine FDA's core public health mission. Every time a PRV is redeemed, the agency must divert resources away from other critical work, which could delay approval of important human drugs. And despite my concerns, I look forward to working with the chairman and the rest of the subcommittee to further discuss how to resolve existing issues so that we can end up with a bill that will appropriately incentivize development of medical countermeasures and best serve the American people. The second bill, H.R. 921, the Sports Medicine Licensure Clarity Act of 2016, will ensure that sports medicine professionals are covered by their liability insurance while they're traveling with their teams. Medical licensure is state-specific, so when a provider travels with a team, they're often practicing without a license and without their medical liability insurance. And this is a common-sense bill that solves a problem unique to sports medicine professionals since they travel out around the country with their teams. What's important is that it does not allow these providers to practice beyond the scope of their license or to treat athletes off the field. I'm pleased that the sponsors were able to work with the committee and stakeholders to ensure that the bill achieves the right balance. I want to thank Mr. Guthrie, and Representative Cedric Richmond for being open to these changes, and I urge members to support its passage, and thank you and yield back. Thanks, Mr. Chairman.
Chair, thanks, gentlemen. Now recognize the Vice Chair of the Subcommittee, Mr. Guthrie. 3 minutes for opening statement.
Thank you, Mr. Chairman, for calling this markup and including H.R. 921, the Sports Medicine Licensure Clarity Act. This bill will ensure that sports medicine professionals can continue to work to provide high-quality and timely health care to athletes when traveling with their teams across states. Athletes at the high school, college, and professional levels frequently travel to different states to attend games, playoffs, or other sporting events. When the teams travel, so too do the sports medicine professionals who care for the athletes. However, there is a lack of clarity surrounding the legal protection for these sports medicine professionals who travel with their teams and are under a moral and professional obligation to treat injuries when they occur. Because of this lack of clarity, the sports medicine professionals are at great personal and professional risk because medical liability insurance carriers may not cover their work when done out of state. This bipartisan bill has the support of many of my colleagues here today. This bill provides a much-needed clarification for these sport medicine professionals as they care for athletes. I would like to thank Chairman Pitts for including this bill today and acknowledge the efforts of our committee staff in help in advancing this bill. I ask my colleagues to join me in supporting this bill, and I yield back the balance of my time.
Chair, thanks, gentlemen. Now recognize the gentlelady from Indiana, Ms. Brooks. 3 minutes for opening statement.
Thank you, Mr. Chairman. I would like to thank my friend Congresswoman Eshoo and the committee staff on both sides of the aisle who've worked together to craft a bill, H.R. 3299, Strengthening Public Health Emergency Response Act. This bill, first and foremost, puts the health and safety needs of the American people, mothers and fathers, children and loved ones, above partisan differences. Reacting to crises as they happen can and does cost countless lives and billions of taxpayers' dollars. This isn't governing and should no longer be an acceptable strategy. There are steps we can take today to strengthen our underlying biodefense enterprise that will enhance our readiness for the next biological threat that reaches our shores, whether by an act of man or an act of nature. This legislation ensures public safety and preparedness goals are being met by requiring the GAO to examine a grant program designed to help states, hospitals, and public agencies prepare for and respond to disasters. It also tackles our broken acquisition process by returning contracting authority to BARDA and requiring BARDA to coordinate with the CDC to stockpile efforts in order to avoid any readiness gaps or conflicting priorities. BARDA is designed to be nimble in its operations. However, the current cumbersome arrangement has created unnecessary confusion, delays, and uncertainty that can imperil time-sensitive national security countermeasure contracts. We're also spurring innovation and meeting the needs of the future. This bill creates a true incentive for our private industry partners to develop medical countermeasures for threats on the Department of Homeland Security's material threat list by adding them to the PRV list. The threats on the DHS list are those pathogens designed to be of significant and real threat to our national security. By their very nature, there's virtually no private demand for these vaccines and treatment, and thus little investment to invest in researching, developing, and manufacturing these medicines. However, at no cost to the taxpayer, we can keep industry engaged in the R&D of life-saving medical countermeasures. As we consider the ideas included in the bill today, I'd encourage my colleagues to keep in mind the problem we are trying to solve together. It's our job to protect the American people. The security of our country and our citizens must be our first priority, and I look forward to working with my colleagues to pass H.R. 3299, and I urge support of the legislation and yield back.
Chair, thanks, gentlelady. As usual, all written opening statements of the members will be made a part of the record. Chair now calls up H.R. 3299 and asks the clerk to report.
H.R. 3299, to amend the Public Health Service Act to ensure preparedness for chemical, radiological, biological.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. So ordered. We are now on H.R. 3299, and the subcommittee will reconvene at 2 p.m. tomorrow. I remind members that the chair will give priority recognition to bipartisan amendments. I look forward to seeing all of you tomorrow. Without objection, the subcommittee stands in recess.